We're live.
Okay. Good afternoon, everyone. I want to thank everyone for joining us today. The Senate President and I called this meeting of the COVID-19 Joint Work Group in order to get another update on our state's vaccination efforts. We're now in legislative session, and I expect our standing committees will deal with COVID-related policy on a near daily basis. But I do anticipate this body, a cross-section of the General Assembly, will continue to meet from time to time for COVID-19 updates. We know that across the nation, we are not meeting the goals we've set for vaccinations, and we certainly are not on pace to hit the 100 million vaccination goal that President-elect Biden has set. I understand that we have picked up the pace on vaccinations, and I'm looking forward to getting an update from the health department and our local partners. Now I'll turn it over to the Senate President.
Thank you, Madam Speaker. I think you said it well. I think what our objective here today is really to understand how the state can support the administration of the vaccine that's happening at local health departments and other vaccination sites. There's nothing more important in state government than the distribution and administration of these vaccines. With that, would like to welcome Dr. Chan and Mr. Yee. Appreciate you being here today, and we'll hand it over to you all.
Good afternoon, Madam Speaker, Mr. President. Webster Yee on behalf of the Department of Health, and with me my colleague, Dr. Jinling Chan. If it pleases the work group, I'll just go through some very quick summary stats, and then Dr. Chan will take over for the bulk of the presentation and a vaccination update. First, to all of the members of the General Assembly, the Department of Health sends its best wishes for a productive and safe General Assembly session in 2021. Today, almost 9 months since we were last before the General Assembly, the Department of Health and the thousands of employees in our local health departments have been working pretty much 24/7 to do the best that we can to keep Marylanders safe. Back in March, when Deputy Secretary Fran Phillips and I were before this body, we were doing about 50 tests for COVID a day. More recently, we've been doing well over 50,000 tests a day, and in certain circumstances, 60,000 tests a day. Since March, we've conducted over 6 million cumulative PCR tests, and our average right now is about 43,500 tests a day. As part of the testing, we have done over 140,000 contact tracing cases and investigations, and we have reached 160,000 contacts by over 1,500 contact tracers. Perhaps most importantly, we are extremely grateful for the 1.6 million Marylanders who have signed up through their smartphones for either the Apple or the Google exposure notifications. And we thank Marylanders who have answered the call and helped our contact tracers with their investigations and assisted in identifying individuals that needed to self-quarantine. Next slide, please. Over the past 9 months, the state of Maryland has purchased over $800 million in PPE. We've distributed 89 million pieces of PPE, and we believe that we have sufficient supply to take care of any surge in the next foreseeable future. We are, for the supplies that we're a little bit short of, we have active orders in place. Over the past month and a half, with the incredible support and partnership of the hospitals and the nursing home industry and all of our local health departments, we have done our best to ensure that every Marylander who needs a bed, a hospital bed, is able to get a hospital bed. And it has been an incredible amount of work between our MIMS partners, our hospital surge planners, and the hospitals who speak every day to try to get things worked out so that Marylanders are able to safely be shifted between hospitals and to get the necessary medical treatment that they require. Next slide, please. The 7-day positivity rate is 8.53%. We seem to be in the midst of a surge right now. We are doing our best to try to keep that number as down as possible. The governor has issued travel advisories. We have pledged with every Marylander to limit their holiday travel, and for the most part, Marylanders seem to have listened and to have helped both themselves and all of us out by keeping travel to a relative minimum. At this point, the most important thing that every Marylander can do is it's not too late to get a flu shot, and it's still absolutely imperative that every Marylander wear a mask, wash their hands, and practice physical distancing to the extent possible. Next slide, please. Our case rate is per 100,000 is 53.4. That's just over the past 9 months. Next slide, please. Our hospital census as of today is 7,481. We are below the first trigger point of 8,000 for hospitals to implement their surge plans. As of today, our hospital census for COVID-19 patients is right around 1,900. About 24% of all ICUs, 24% of our ICUs have COVID-19 patients, and COVID-19 patients account for about 26% of all hospitalizations. But if I can get the next slide, please. You'll see that's basically the breakdown over the course of time. Our COVID-19 patients have remained largely steady. However, that's because hospitals have been admitting and discharging them at about equivalent rates. But as you can see, the total amount of patients in the hospital system is right below the 8,000 mark. And so earlier on Monday, we've advised all of the hospitals to just be as prepared as they can and to work with each other and with the state to ensure that our hospital system doesn't breach any of the thresholds. Next slide, please. As announced by the governor yesterday, Maryland has identified 2 cases of the UK variant in Anne Arundel County. The State Public Health Lab is testing representative samples for this variant daily. And as of a few days ago, we are asking all labs that perform COVID testing for the state to also perform representative variant testing and to let us know as soon as possible. And with that, I'm going to turn this over to Dr. Chan for the vaccination part of the briefing.
Thank you. Okay, great. Good afternoon, Mr. President and Madam Secretary. Want to thank you for having us here to provide a briefing about the Maryland's vaccination plan and the distribution as it's gone so far. So what you have before you is just a schematic about how the vaccine distribution process works. So our goal ultimately is to make sure that every Marylander who wants a vaccine receives it. However, as we have been ramping up over the course of the last month or so, since we first received vaccine, which was on December 14th, we are working very closely with our federal partners to ensure that vaccines get to facilities. And so from the time that we actually are notified of what our allocation is, we then look at which providers we're directing it to, and then putting in those orders, and then the federal government, their partners, both with Pfizer directly and with Moderna, are then delivering those vaccines directly to the facilities. And ultimately, that might take up to a week for that entire process to happen before the vaccines actually are available for administration. Early on in the process, because these are new vaccines, there is an element of training to ensure that staff have the tools and the information that they need to be able to handle the vaccines carefully. Particularly the Pfizer vaccine, as you know, has some specific handling requirements and a certain shelf life once it is actually taken out of the freezer box. And so we want to be sure that people are handling those vaccines carefully and managing the cold chain appropriately to minimize any potential waste and to ensure that vaccines are administered for every individual in as safe a manner as possible. So to date, most of the vaccines have gone to both hospitals and also to local health departments, and they have implemented their plans to ensure that they administer those vaccines safely and efficiently. So every week, the federal government informs us of how much each allocation each week is for the following week, and so then we are looking both at the number of doses that we've allocated already and what their utilization rate is to determine what the allocation would be for the following week. So then again, those once we put in the order, those are shipped directly from and via the Operation Warp Speed process directly to the facility, whether it's a local health department or a hospital, or as we've begun to expand to federally qualified health centers, and there will be more providers as we roll forward. In addition, as you are aware, we have also provided a significant amount of doses to CVS and Walgreens as part of the federal long-term care facility program, and those doses have been used and are continuing to be used even as we speak to vaccinate residents and staff in nursing home facilities. So, next slide, please. So, as we roll forward and, what we have provided as support for our facilities who are currently receiving vaccine, the governor has activated the National Guard to support our continued efforts with COVID response, and vaccinations is another aspect of that that work that they are doing. So the National Guard has been dispatching emergency support teams to local health departments in the past week to support vaccination clinics in different counties. Each of these teams consists of about 14 Guard members who are both some of whom are trained to actually administer vaccines and have actually been doing so among the National Guard members doing flu vaccination clinics this fall. And they also are providing logistical support. In addition to Maryland Responds, the Medical Reserve Corps, we have already identified about 700 qualified volunteers who are ready and willing to help with vaccine administration. We are sharing this information with local health officers so that they can incorporate these volunteers within their vaccination clinics and also to support other COVID response efforts. So Governor Hogan, so next slide. There we go. Thank you, on the data reporting. So we know that we are following our Immunet program data, and that's the data that's reported on a daily basis on the vaccination dashboard. We are hearing from and seeing that there are some reporting delays, which is why Governor Hogan issued an executive order last week mandating that all providers who receive vaccine and administer vaccine in the state of Maryland report to the state's immunization information system called Immunet within 24 hours after vaccines are administered. We are continuing to work with our partners, both pharmacy partners and other providers, to make sure that that 24-hour reporting period is honored. So, and it is making it difficult sometimes because the lag can be longer than 24. It can be 48 and up to 72 hours. So that sometimes the picture that we get each day is there is a bit of a time delay on that. Next slide. So I wanted to talk through a few of the other directives that have been recently issued, again, to help our overall effort and support our overall effort in ensuring that we use our allocation efficiently and with minimal waste. And so one of them is that we did issue a directive and guidance to not only hospitals and local health, but all providers going forward, that in terms of prioritization for allocation in future weeks, that they need to demonstrate that they have used at least 75% of what has already been allocated to them. And so that is something that we'll be taking into consideration as we go forward. In addition, next slide. Any provider that has excess doses, particularly those that have a certain shelf life, if they've already been taken out of the freezer and need to be used expeditiously, we ask that they contact their local health department to coordinate the rapid utilization of those doses to vaccinate priority populations. And so that's something to make sure, again, with both Pfizer and Moderna vaccines, once they're drawn up or once they've been thawed, they do have a certain amount of shelf life in which those doses have to be used expeditiously. Next slide. So the other component of our approach to the vaccination plan and implementation is what we've been calling, and the governor's called, the Southwest Airlines model of distribution. So it is a rolling distribution such that as we receive vaccine, and we've already started to do this here in the state, that we have certain target populations, and we'll begin vaccinating those populations, but as we get more, we'll continue to open it up to additional priority groups. And so this is the Southwest rolling distribution model. So we're not planning to wait to accomplish 100% vaccination of any single population group before we move on and be able to open it up to others. However, it is important to know that we have so far been only getting 72,000 vaccines a week, and so we also want to minimize the waits that other states have experienced to the extent we possibly can. It is important to note that members of previous priority groups can still get vaccinated even if they choose not to get a vaccine at this point in time. Next slide, please. So, again, we're evaluating what and asking the federal government for additional guidance based on some of the announcements that were made yesterday by Secretary Azar as well as Director Redfield and Dr. Fauci. But for what we know at this point in time and what has been communicated to us is that we would expect to receive roughly 10,000 doses a day. So again, about 72,000 a week is what we've been had been told we would receive here in the state of Maryland, that we then allocate to a number of different providers around the state. We anticipate, based on the announcement, that that will change, but we are still waiting for additional details, and we'll be asking questions to make sure that we understand what the implications may be for Maryland. However, based on what our current knowledge is, by the end of May, we might be able to receive 1.8 million doses, which is only 30% of the population. So again, some of this may be changing in the next couple of weeks, but as of right now, our operating assumption is that we will continue to get 72,000 doses a week. There are other things that may change that allocation, which might also include other vaccines being approved. And there are other vaccines such as AstraZeneca or the Janssen vaccine that are in later stages of clinical trials. And from what we understand from the federal government, that may not be until March at the earliest, where those might be considered for additional consideration and possible approval. Next slide. So again, due to the limited initial amount of vaccine that was coming into, or that's coming into Maryland, we are taking a phased approach to the distribution that targets critical and high-risk populations. And so the updated pyramid, as you see here, that the governor discussed last week in great detail, is based in part on the recommendations from the Federal Advisory Committee on Immunization Practices, and we expanded the priority populations for COVID vaccinations. And so we will distribute vaccines at this point to 5 different priority groups based on the relative risk of exposure or of developing serious illness. So next slide. So we are still across the state, still in phase 1A, and so vaccine priority in this phase, as we have discussed, is primarily for licensed healthcare providers and their support staff, nursing home residents, first responders, including the career, the volunteer, and commercial EMS professionals, as well as police officers, firefighters, correctional facility guards, and healthcare staff in corrections. Phase 1A began in December, and so that's where we started with the frontline healthcare providers and hospitals, and has expanded in the last couple of weeks to include healthcare providers who work in the community, including in home health and other settings. And I would note that Phase 1A includes more than 500,000 Marylanders. And so, to date, as of this week, we will have just received approximately 500,000 vaccines. Next slide, please. So, in Phase 1B, vaccine priority will be given to residents of group homes and assisted living and other congregate care facilities, as well as adults ages 75 and older. We are also prioritizing educators and other staff who work in K through 12 and daycare faculty and staff. This phase will also include high-risk incarcerated individuals, so again, individuals with a high-risk medical condition that increases their risk of complications, as well as executives who are required for continuity of government. Phase 1B, we're currently expecting, again, this is based on current projections of approximately 70,000 doses coming into the state each week, that we will be able to have this phase begin across the state by late January or early February. This particular phase includes about 860,000 Marylanders. Next slide. So in Phase 1C, vaccine priority will be given to adults who are 64 to 75, public safety and public health workers that were not covered in the 1A population, and then focusing on essential workers in critical industries such as in food and agriculture production and manufacturing, in postal services, public transit, and grocery stores. We are expecting, again, based on current projections, which may change, that it would begin in early March of this year. And this particular phase, we are estimating to include about 772,000 Marylanders. Next slide. So then in Phase 2, there we go. In Phase 2, vaccine priority will be given to adults who are aged 16 to 64 who are at increased risk of severe illness due to an underlying medical condition, which might include asthma, heart disease, diabetes, and other chronic kidney disease and other conditions. It will also include essential workers in other critical areas, such as in utilities, in transportation, and other infrastructural industries. This will also include, in Phase 2, the remainder of incarcerated individuals who were not vaccinated in Phase 1B. So overall, we estimate that Phase 2 would include another 1.1 million Marylanders. Next slide. So how can Marylanders help And, that's a question that we're getting every day because, we all know, how hard that this pandemic has been and the impact it has had on all of us and some families and communities more so than others. And so if Marylanders want to find more information about the progress of vaccination and information, they can opt in to receive text alerts through our 211 service, and so they can text ND Ready to 898-211. I would also encourage Marylanders to look for information from trusted sources about vaccines, and be careful about rumors or information being passed around on social media, and encourage them to go to cdc.gov or to our website at covidlink.maryland.gov, which will have more information about the vaccines themselves as well as our vaccination plan. So, next slide, please. So many Marylanders who are currently eligible to get vaccinated will be provided a link and other instructions by their long-term care facility if they live in a facility, or their hospital if they're a hospital staff person, or local health department. More information and, as we expand the number of providers who are able to receive vaccines, if we get more vaccines over time, local providers beyond local health departments will also be able to provide vaccinations. And so that may include pharmacies, as I've already mentioned, federally qualified health centers, other primary care settings, and other providers. So we are working to expand as quickly as we can, but again, very much predicated on how much vaccine we receive in the state. And, I think that an important part of the message is that, we are rolling this out as quickly as we can, and we urge Marylanders to have patience and continue to practice the important preventive public health measures that we continue to emphasize to, wear masks and practice social distancing and avoiding large gatherings. Next slide. Oh, yep, here we go. So with daily transparency, we want people to understand and be able to go to our website at covidlink.maryland.gov to access data. It is updated on a daily basis, so as we get information from our immunization system, it is uploaded into the dashboard, and we continue to refine that dashboard so that more detailed information can be provided to the public. Currently, more than 150,000 Marylanders have been vaccinated, and as of last week, we have started additional vaccinations for second doses, and so we have about close to 10,000 people now who've been vaccinated and have completed their entire vaccination series. Next slide. So what we are working on now and beginning to roll out is a public outreach campaign, and we've been working over the last several months with trusted community partners in a number of different venues, including our community stakeholder work group, healthcare professional work group, as well as a work group that's been coordinated with, with businesses and with the Department of Commerce and others. And so those have been very important places where we've received feedback about messaging and working with trusted community partners and priority group representatives. And the main focus of this campaign is to educate the public and about what the vaccines are, about information about safety and efficacy, because these are the questions that people are asking us, and we want to be able to provide that information to all Marylanders so that they understand not only what the vaccines are, what their efficacy is, but also what the impact could be and the benefits for their family and for their communities. The materials under development have been researched It will be easy to understand, transparent, and available to all Marylanders, especially those who are disproportionately affected by COVID-19. And again, this has been something that has been a key focus of ours, and that's why we've engaged community partners from a diverse groups around the state, and representing diversity in many different ways, including in terms of reaching out to disability groups, to minority populations, and others. Our campaign messaging is going to be representative of all regions as well as demographic groups, and will complement some of the communications that are also available from CDC and others. So, last slide. So, as we proceed with vaccinating the public, it is important to continue to slow the spread of COVID-19 with the methods that we continue to push forward. As Mr. Yee noted early in this presentation, as the governor announced yesterday, there have been 2 individuals who've been identified with the UK variant, as it's known, of the COVID-19 virus. And we anticipated that would happen, and that it was already here in the state. And because it has the potential to spread quickly, we really urge all Marylanders to take precautions and to take it seriously as we go forward in the coming weeks and months. So thank you so much, and we are happy to take questions.
Thank you both. I believe we have our first question from Chair of the Finance Committee, Senator Dolores Kelly. Senator Kelly, give us just one moment to unmute.
Okay, I think I'm on. Okay, I have 2 questions. One is about the 1,600 or so small assisted living entities in Maryland, which never get visitation. We don't have regulations that are really followed, and we don't know how the people are doing. Many of them in private homes with 2 or 3 people to a bedroom. And I'm wondering if it wouldn't be efficacious for the department, since you do have most of them licensed, to at least send out a flyer to those individual licensees to let them know what's coming up, and for them to begin to seek appointments, or for you to give them some assistance. Because there's nobody who's in a professional category that is ever overseeing what's happening, and these people are so spread out in all of our 24 counties and with no help. I recently read about a woman who was arrested because she had not, in fact, she committed murder. She had not for a year opened the prescription packages for the people in her assisted living. And some of them were still the way they had come from the pharmacy over a year old. So I'm really concerned about those. The other thing I wanted to ask is if it wouldn't be reasonable and helpful, in fact, for the members of the General Assembly who are interested in getting vaccinated to go ahead. As such a small group, relatively speaking, but you could ensure that we don't lose a quorum, that we have continuity of government, and that we're able to work on health issues and other issues that are important to the economic and physical health aspects of the pandemic. Those are my 2 questions. Thank you.
Thank you, Senator Kelly, for that. And so all assisted livings are, of course, as you noted, licensed here in the state of Maryland. And so if there are any concerns from residents or family members about the operation of any of the assisted living facilities, regardless of size, we would urge them to contact the Maryland Department of Health, specifically the Office of Healthcare Quality.
The problem, however, is that you're never in touch. It's not your fault. We don't have the infrastructure in Maryland. So there is no regular connection with any entity of government. They get licensed and pretty much they're on their own. So I'm just thinking, since you do know the entities that are licensed, if some kind of a flyer could just be sent out to those, that would probably take care of most of the 1,600. so that they know. There's no way to be sure they would know till the Lord comes with the second coming, that anything at all is going on. Those people are not professionals. They're never visited. They aren't regulated. So that's my concern.
All right. Thank you for that suggestion. We'll definitely take that back to our team, including our congregate care team, to see what they may be able to do on that front. And in terms of your suggestion about request about General Assembly members being vaccinated, that is something that we are discussing now, and that is part of our planning for continuity of government. So thank you for that question.
Okay, Minority Leader Kipke.
Thank you, Madam Speaker. Thank you, Dr. Chan, and to everyone there working so hard for all of us. I've got a couple of quick questions. One, yesterday, Secretary Azar said that they were no longer going to hold back the second vaccine. And I'm just wondering, one, from a clinical perspective, what, if I think the goal is to get more people that first vaccine, what does that mean clinically if we're delaying the second vaccine? And as sort of a piggyback on that, what is the, has Maryland's plan changed any as a result of that?
So thank you, Minority Leader Kipke. Thank you for your question. And, I think that with the announcement yesterday, and also with the announcement that we heard coming through on Friday from the Biden transition team, we knew that this was a possibility. And so we're currently evaluating what that might mean for our rollout plan overall. There are some questions that we would have for our federal partners regarding what the actual number of doses that might mean for Maryland, so that would help us in our planning. So there are no specifics at this point in time, but our planning team is looking at that right now. In terms of delay of the first dose, I think that it would be helpful and important to know what the data is that they may have, because the clinical trials for both the Pfizer and the Moderna vaccines, they had sufficient clinical data coming into December to actually put their applications in for the FDA EUA approvals and then achieve those. However, the clinical trials actually are continuing because of the continued monitoring of the participants. And so if there is new information to suggest that a one-dose regimen may have significant protection and coverage, then that would be helpful for our decision-making. However, at this point in time, because the trials were specifically looking at and using a two-dose regimen, the information about protection after one dose is quite limited and really only looks at infection that may have occurred in that time frame between the first and the second dose. So there's only limited numbers that contribute to the information that we have right now. So and looking for more information. So thank you.
And quickly, some jurisdictions have communicated to us, their health secretaries have told us that they've completed phase 1A and they're ready to move to phase 1B. And they're told that they're not allowed to do that by the Department of Health. And so they're just sitting in a frozen state. They're not moving forward. Is that true?
So what we have actually directed our local health departments and other partners to do is that, in particular, some of the smaller jurisdictions, is to actually help us with some of the vulnerable adults in the early 1B population in assisted livings and congregate care settings. So we are not telling them to stop. We're telling them to move forward and to begin to vaccinate other vulnerable adults.
Okay, and then lastly, Madam Speaker, the chart that you showed looks like phase 2 it wouldn't begin until March. I'm just curious, what should Marylanders expect in the way of the total percentage of vaccination? When will, 50% of Maryland, 30% of Maryland, from what we can see with the pipeline of vaccines coming into the state, many people are chomping at the bit to get this vaccine. What is a realistic expectation for Marylanders?
So, again, you saw where we have our current estimated timeframes, and these are based, on some assumptions that I outlined in terms of what the pipeline is for vaccines at this point in time. And right now it is a hard, 72,000, give or take a few thousand a week. And so based on that projection going forward, if that's all we get for the next few months, then that is what the time frame is. We, of course, are urging our federal partners to increase allocations or to increase production so that we actually can move ahead much more quickly so that we can provide vaccines to more providers and get vaccines into more arms.
So the end of the year is kind of where we're looking at to get Marylanders vaccinated? Is that realistic? Is that true?
So, I think that at this point in time, it's hard to put a hard and fast timeline on where everything is. Again, what we have put forth in the pyramid and the slides that we presented today and also last week, that's our best estimate of a time frame. However, if what the federal government partners are telling us is true, that production will increase and that new vaccines will come online, the anticipation would be that the time frames would actually be much sooner than what we're currently projecting using very conservative estimates.
Next up is Senator Paul Pinty, Chair of our Education, Health, and Environmental Affairs Committee.
Thank you, Mr. President. I had a couple of questions. Dr. Chen, you said you vaccinated 150,000 of the 500,000 in that first category. I guess my question is, how many of the remaining 350,000 have refused? I've heard in some hospitals or nursing homes as many as 45% or 50% of the people have chosen not to get it. So that leads me to the question you talked about, the Southwest model. So I'm just trying to understand, of that 500,000, taking the 150 and those that have refused, how many more do you have to process and vaccinate before, for example, you get into 1B? That's my first question.
So yes, we have heard the same thing, and that's why it's critically important that we continue to, and ramp up our education campaign for both healthcare workers as well as the general public. And when we say 1B and 1A and moving ahead, we understand that it may not be at the exact same cadence across the state, but with our estimates, it's really about how, the estimated time frame for most of Maryland, if not all of Maryland jurisdictions, to at least begin into that following phase.
Well, I appreciate it. It doesn't give me a lot of clarity. Let me offer two other questions. How many didn't use at least 75% of their allocation that you have crossed off?
I'm sorry, could you clarify that question one more time? I might have missed it.
You would set a policy that said if you didn't use at least 75% of your allocation, you'd be cut off. And I'm curious to know how many did not utilize 75% of their allocation.
So this is just a policy that we have begun last week, and so it's not a hard and fast cutoff. It is about how we may prioritize allocation. So we may determine that we redirect our limited allocation to another provider and come back to them and work with them on trying to address any issues that they may have with actually administering and using their existing vaccine allocation. Hard and fast cutoff. It is a general overall policy that we may use that as that it is a factor as we're considering allocation.
And the final question, I'm still trying to understand, what is the largest obstacle to vaccinating more people? Is it the delivery? Is it people sign up at a hospital and don't show? Is it not enough people to give the vaccination? I mean, how can we move this more quickly? My understanding is there are more doses than vaccinations. And if that's the case, what is the primary obstacle that we can help with, or maybe not help with, but we need to know what is the biggest challenge you and the administration face in not getting more vaccinations more quickly?
Mr. Chairman, this is Webster Yee. I think the easiest and the most correct answer to your question is the amount of doses of vaccine that we get from the federal government. As Dr. Chan said, we're getting about 72,000 doses a week. Maryland right now, for the past couple of days, have been doing about 12,000 doses a day. We are doing pretty much our target, which is at least 10,000 shots a day. And so basically the short answer is if we can get more doses from the federal government, we will do our best to use them.
So then you are utilizing all of your dosage. It's not a matter of any slowdown in the state of Maryland. Is that what I hear you saying?
Mr. Chairman, I think all of our providers, the hospitals, the local health departments, the FQHCs, everyone is working to the best of their ability to get doses into as many people as possible.
Thank you, Mr. Senate President and Madam Speaker.
Majority Leader Lukey.
Thank you, Madam Speaker, and thank you, Dr. Chan, for the briefing. So I'm curious, the dashboard today says that a little over 160,000 Marylanders have received their first dose, but I can't find anywhere on the dashboard where it shows how many doses have actually been distributed to providers so that we can get a sense of how we're doing and making sure that those doses that are distributed are actually getting to people. Do you know how many today have been distributed from the state to the providers that will be administering them?
We believe that, so we have about 550,000 doses that have been delivered to providers here in Maryland. I would note that of that, there's 8,000 doses that have been transferred to the District of Columbia for their use. And in addition, there is 60,000 doses, of which approximately 25,000 doses have been utilized by CVS and Walgreens for purposes of vaccinating the residents and staff of long-term care facilities. So that is an amount that's been in reserve, but is still counted among Maryland, as part of Maryland's allocation for vaccines.
So we're still in a place where less than a third of the doses that we've distributed have actually been administered?
So this also includes some of the second doses that are coming through as well. And so, I think that the accounting and tracking and making sure, we want to be sure that that is clear. And we continue to update our dashboard as well to make sure that that information is available.
How many of the, is it, it's just a access to data question, right? So is it possible, first of all, for that data to be represented in some way on the dashboard? And do we know how many of the 550,000 doses that we've gotten have been held back for the second dose?
I will have to, I don't want to misspeak and tell you something differently, because again, we're tracking this very carefully and making sure that we keep track of the first doses and the second doses. So I can provide you that information perhaps afterwards. But I will say that we're continuing to make improvements and add more information and more detailed information to the vaccination dashboard to be able to answer your questions and others.
Well, I appreciate that. One final question. So one of the things the dashboard shows is vaccination rate by region, and consistently the Metro Washington region has lagged the rest of the state and is now, it looks like, about half of the rate on the Eastern Shore. Can you explain why that is?
So there is a large population, of course, in the metro region, of course, in both Baltimore Metro as well as the National Capital Region. And so, but if you actually look at the number of vaccinations that, say, Montgomery County has done, they've actually exceeded the, most other jurisdictions in terms of actual numbers of vaccines in arms. So it's a proportion of the population. And again, we are looking to provide more detail on the dashboard for that.
I get that, but then wouldn't we be sending more vaccine to places with more people? Is that not, I don't fully understand.
Correct. So, we're looking at two different factors, and, when we had the discussions with local health departments, for example, as we've started out, it was primarily based on a pro rata, a per population base allocation, depending on the amount of vaccine that we're receiving, and we're beginning to factor in utilization. And we've also asked the health departments to tell us, how much they believe that they would be able to use in the following week, with their appointment structure, with the actual vaccination clinics, so that we can factor that in and what their needs might be, as we factor in allocation planning for the following week.
Okay, thank you, Madam Speaker, Mr. President.
The next question is from Senator Lamb.
Thank you, Mr. President. Thank you to Dr. Chan and to Mr. Webster. I had a question about the number of hospitalizations, but I want to start with the vaccination program. I think to answer Senator Pinsky's question too, I think the delivery is probably the most important, because if you're not getting the actual vaccines themselves, there's nothing to distribute. But the administration piece is critically important too. And as someone who's run the administration program for a very large health system, that's in no short order very complicated, right? And so what is your plan for the state beyond just the National Guard? And just to be clear, these are lay people that are being provided special training to administer intramuscular injections, right? To extend beyond just the National Guard once we have greater distribution and delivery of vaccines. That I'm concerned that, that's getting us to the, 10,000 vaccines being administered per day and meeting the incoming deliveries that we're getting as a state. But we're hoping and obviously believing that we will get more, hopefully sometime soon, more than the 70,000 a week. At which point, providers in many of our health systems are already strained. You can pull medical reserve corps folks, but a lot of them are also the same people that are in the health systems themselves. You'd be robbing Peter to pay Paul out of the medical reserve corps to some extent. What is the plan after that to be able to look towards? Has there been much information given to the outpatient providers, the community providers, as to how they would integrate into this? Because it doesn't seem like they're getting much information as of yet. Where is that in the planning process?
So thank you, Senator Lamb, for your question, as well for your comment, and thank you for the work that you've been doing with the Hopkins system in vaccinating healthcare providers. And I just wanted to take a moment to reemphasize your comments about the detailed work that is being done for vaccine administration, and the training and other aspects that are very critical to making sure that we have a safe and efficient vaccine delivery system. To your question about, if we are to, what our further plans are, we have discussed this before, in that as our vaccine allocation increases and over time, we are already beginning to enroll other providers across the state, and we'll have, additional providers, including in outpatient settings, including in pharmacies and many of the other current providers that are already doing vaccinations, for example, like flu. And so those, we will be able to increase access points for individuals. So as we roll into other phases of vaccine priority groups, we will also have increased access points for vaccination. So that's a key factor to expand vaccine availability across the state. And there's going to be more information to come, as in the coming days and weeks.
Okay, and I encourage you to really lean on that preparation and planning, because that piece is really important. I think, you can't understate the amount of coordination that's required for distribution, and then finally the administration piece. And I think a lot of providers are ready, willing to help, but they haven't been, informed or pulled together to coordinate this and manage this a piece of administration at the end. The second question, last question I had, was with regards to the data points that Mr. Webster had presented earlier on, that, I think many of us are concerned watching those numbers creep up, and we've, pushed past many milestones already. We have a positivity rate over 8%. We have over 50 people per 100,000 now that are contracting COVID. We're approaching that 8,000 inpatient hospitalizations that you're seeing on the screen now, that trigger point. I know health systems have been asked to stretch to prepare for what happens beyond 8,000. I know many health systems now are at a stage where we are seeing the same number of hospitalizations that we saw back in April. And so we're not in a good place now. We're not near the end of the winter time yet. And with the expected number of cases continuing to rise, the whole point of bending the curve was to keep us, within the bounds of what our healthcare system could handle. We're rapidly exceeding that. And so, what other trigger points do we need to see to have, more stronger public health measures put in place? And, what is going to happen, when we exceed the 8,000 and the 9,000 trigger points? What do you plan to put in place at that point?
What do you want to do? We here at the Maryland Department of Health, as well as with the governor's office, are, of course, monitoring these numbers on a daily basis and continue discussions. Of course, a lot of focus on vaccine, but you're right that the hospitalization numbers are equally and if critical for us to consider. As we have implemented some of the programs that have been very helpful, I think, in trying to direct patients to the correct level of care to make sure that they have access to ICU beds. I think that has actually been helpful across the state, but we will consider, these metrics and others to make decisions, and those discussions are ongoing with the governor's office.
I didn't hear what the next level of public health measures would take place, but I assume that you were thinking about them.
Correct. In terms of the different tools that we have at hand for community mitigation, those are being discussed as well.
All right. My point being that, we saw a large degree of restrictions and public health measures undertaken back in the spring when we saw hospitalizations at this similar level. We're not seeing that level of public health measures being implemented now. And obviously, as you know, there's a delay in all of this. So my concern is that without a greater strength of intervention in the public with these public health measures, we could very easily blow past that 8,000 trigger point and 9,000 and end up in a very difficult place.
Thank you.
Thank you, Mr. President.
Okay. Next, we have the Vice Chair of Health and Government Operations, Jocelyn Pena-Melnick.
Thank you, Madam Speaker. Good afternoon. I have very quick questions. The first one is, how much vaccine capacity do we have already with CVS and Walgreens? And what is their weekly use of those shots? That's my first one.
So thank you for that question. So it will vary depending on how many clinics they are able to schedule each week in coordination with the nursing homes and going forward with assisted livings and group homes. And so we'll have to get back to you on the specific numbers. I don't have it in front of me right now.
Okay, thank you. The second one is basically the CDC issue new guidelines that expand the coronavirus vaccine eligibility to age 65 and older. And they're actually, the states are being told to immediately expand to 65 and older. This concerns me greatly because if you look up the African-American, the life expectancy for an African-American person is 75 years old. The life expectancy for a white person is 80 plus. And you have 75 years old, that's phase 1B. And then 65 is another phase. And if we look at the, how the coronavirus has affected African Americans and the immigrant Latino community, they have taken the brunt of it. given that the CDC just moved and is encouraging states to do this, and given the life expectancy for people of color, especially African Americans, why don't you immediately go and do what the CDC is recommending?
So those, thank you, Delia Pena-Melnick. Those announcements came out yesterday, and again, a lot of the questions that we have are about, how much vaccine we have to be able to make sure that we are able to expand. And so there are some questions that we have for our federal partners in that regard and that kind of planning. So we are looking at how we might change our vaccination plans in accordance with the new guidance from the federal government. I would highlight that the Federal Advisory Committee for Immunization Practices just recently, about 3 weeks ago, issued another set of guidance, and so that has now been changed again this week. And so we are working very quickly to make sure that we have available vaccination capacity. There's a lot of other considerations from a logistics standpoint that we want to be sure of, as Senator Lamb alluded to in his comments, so that we, as we make those decisions.
So I guess my question is, it seems to me that you have over 350,000 doses that appear to be sitting there. We have not received today a clear answer on the backlog, and you said that some providers are not, satisfying those numbers. So what are you going to do? Is there plans to do like a lot of states? Arizona just opened a 24-hour mass vaccination. They're using a lot of states, they're using the sports, the stadiums to do mass vaccination. Are you going to think about doing something like that eventually?
So those plans are being discussed right now. So yes, we are looking at all different venues to be able to push out vaccinations. And some of the where the vaccines are, again, some of them are still being pulled down, by CVS and Walgreens as they're vaccinating individuals in nursing homes, and vaccines are also available, and some are just arriving here in the state, that might have arrived today, for example, that are, counted in our numbers right now that we have shared.
So I guess, and this is my last question, Madam Speaker, and thank you so much for your patience. As we look at the disparities on the Black and immigrant Latino community, what are you doing to ensure that these people, right, they're the highest at risk, that are dying? They include low-income people of color, essential workers, non-English speakers, people that do not know how to sign up online at the porters. A lot of them have type 1 diabetes, type 2 diabetes. How are they going to be able to know that they can get it in 1B, because it's not clear? What are you doing to make it clear to these communities that are really taking the brunt of this disease?
So thank you for that question. And, part of the reason that we have expanded our vaccine allocation to include federally qualified health centers and community centers across the state is precisely for that reason, to make sure that they, are prepared and begin to have available vaccine allocation so that they can help us reach these vulnerable and hard-to-reach populations. In addition, in coordination with our community stakeholder work group and others, we're engaging across the state and working with local health departments, and it would encourage local health departments to engage at that local level with key community organizations, so that there is a partnership between federally qualified or other providers and community organizations who work directly in and with these communities of color.
Thank you. It just seems to me that you need to think outside the box when it comes to the Black and brown communities, that you need to do pop-up testing, that you need to use the stadium and trusted sources. You have to get outside the regular models, otherwise you're not going to reach them. Thank you, Madam Speaker.
Yes, those are all part of planning, right? Thank you.
Thank you. Next is Senate President Pro Tem Melanie Griffith. Senator Griffith.
Thank you, Mr. President, Madam Speaker, and thank you to both of our presenters today. I'm going to be very brief. I know you all have answered a lot of questions and want to thank you for your work and the presentation. Senator Penske asked a part of my question, and that is how people are responding. Are people refusing to take the test? And so I would love to know how we're tracking that, particularly in the 1A category. But I also had another question, and I know we were cautioned not to pay attention to rumors, but I wanted to make sure or ask how we're doing in terms of vaccinating our vaccinators and those healthcare workers that are providing the services, maybe even volunteers that are working at the vaccination or test sites. Are we tracking that and keeping track of how many of them are being vaccinated and making sure that, and I know you're monitoring 24 jurisdictions, just making sure that those that want to be vaccinated that are on the front lines are receiving those?
So to address your first question, what we understand in discussing with various facilities and our hospital partners, that the uptake among healthcare workers varies, and I think generally on average it's about 50 to 60%, but we have heard that uptake in certain facilities among staff, healthcare workers, has been as low as 30%, but also even as high as 70, 75%. So it does vary. And so that's why it is critically important that we continue to provide education and information, address questions that individuals may have, whether they're healthcare providers or the general public who are using these healthcare services. In addition, I would say that what we have heard and this is specific to the long-term care facility program, what we're seeing is that they're starting some of their second dose clinics now. So CVS and Walgreens have 3 planned clinics for every facility, and with the second clinic, they're seeing additional sign-ups for the first time. So for healthcare providers that may have decided not to receive vaccine for the first clinic, but have signed up to receive their vaccine for during the second clinic. So some of it is seeing others receive vaccine and having minimal to no side effects or manageable side effects, and so we're seeing that number increase over time.
Okay, and to the aspect of those who are working in the facilities that want the vaccine, just making sure that those who are vaccinating others, if they are doing that and requesting vaccines, they are receiving them. Are we monitoring that?
So we do not have necessarily a specific metric. I will make sure with our team that if we're able to track that specific metric of people who are qualified to be vaccinators. But our goal was, as we expanded in the last week or two to include all healthcare providers, is to really focus on individuals who could serve as vaccinators in the community. So again, whether they are outpatient providers or in pharmacies and in other settings. So to make sure that they get a vaccine.
Okay, thank you very much. Thank you, Mr. President, Madam Speaker.
The Chair of the Health and Government Operations Committee, Delegate Shane Pendergrass.
Thank you, Madam Speaker, Mr. President. First, Dr. Chan, I want to say to you how grateful that I am for all the work you did to put this together today and your patience answering our questions. This is a lot of information. I assume that our staff will get this out to us, the slides that you presented, which are very good, but I couldn't digest them all as quickly as they were shown. So I'm going to go back to the beginning, which is 43,000 tests per day. My read on what we're doing is 15,000 tests per day from the website. The average I heard today was 43,000, which is quite a lot more than 15,000. Can you explain what I'm missing here?
Madam Chair, this is Webster Yee. For today, we are reporting we had 34,000 PCR test results. So if you can go to slide 4, please. If you, sorry, yeah, that's the right one, I'm sorry. Slide number 6. If you look at the gray bars, that's the daily total testing volume counts. We get results for rapid tests, but we do not report them because they're probable results. We only go with the confirmed results, which are PCR. As
So
you
are
can
you
see,
counting those in the 43,000? Is that what you're doing that's making me not understand it?
no, Madam Chair, these are PCR results only.
Okay,
Numbers that you see in the gray bars are the PCR results, and our math shows it at it's an average of about 43,000.
I'm going to have to try to figure that out on your website. Thank you for that.
Sure.
Okay. I have a whole list. The second thing I want to mention to you is I heard today from a congregate living facility that something went out to them saying, as long as we're already sending in CVS or similar into your facility, and we're vaccinating people who are in the nursing home portion, you are now free to vaccinate everybody in the building, basically, which means assisted living and those kinds of things. We've expanded the eligibility according to CDC guidelines. And this is what I heard directly. And you didn't mention this in the briefing, so I'm wondering if I heard something that is incorrect, or if you just didn't mention it, or if you hadn't heard it yet.
So, Madam Chair, we sent a bulletin out on Saturday to all of the local health departments. Basically, if the local health departments have extra doses, they can go forward and start on assisted living and independent living facilities.
Whoa. I thought it wasn't the health department that did this. I thought it was the private pharmacies that were going in and doing this.
Yes, Madam Chair. And in addition, we activated what's called Part B of the Federal Long-Term Care Pharmacy Program. And we've asked CVS and Walgreens, now that they're kind of wrapping up their first round vaccinations to some degree, we're asking them to work on adding the assisted living and independent living facilities. So we're going to be adding more doses out of our 70,000 allocation towards the assisted living and independent living facilities. And we've asked CVS and Walgreens over the next week or two to schedule with all of the assisted living and independent living facilities in Maryland.
Well, I congratulate you on moving in that direction, because if you have staff that works between the different parts of a facility and you haven't vaccinated everyone in the facility, you're just asking for a problem. And once you have people in the building, they might as well vaccinate everyone in the building. So I'm glad to hear that you expect to move forward with that in the very near future. My third question is, do we request 72,000 doses? And is that from some amount that you have made up, or are we told we can only request up to 72,000 doses a week from the feds?
We are told each week what our allocation is by the federal government. So there is not a request process from the state to the federal government.
I thought there was a request process. I'm just wrong about that?
So we are told every week, and with the holidays, the schedule has been changing a little bit, but as of now, they are telling us through one of their systems on Tuesdays how much our allocation is for the following week. So we know, about a week in advance, and then we make allocations and put in the orders, and then those are delivered the subsequent week, usually between Monday through Wednesday.
So what do you think would happen if we put in an order for 85,000, even if we were told we were getting 72,000 the next week? Do you think it would go up?
We can certainly, I will ask our our immunizations team, but I believe that within the ordering system that CDC has, that there is a maximum number of vaccines that we can actually put in order for.
So,
I would really appreciate, yeah.
If I may interject, so what happens is Dr. Chan explained briefly, and I'll just add 2 more sentences to that. We get the 72,000 or whatever our next week's allocation amount is from the federal system. We then work with our providers, we put in our request, and then the federal government confirms our order. So we've been putting in exactly what they've allocated to us every week. We allocate 100% of what they give us, and then they confirm the order. And occasionally, over the past week or two, we've had some minor, folks where the orders didn't go through. So it's the Fed. We could put in 85,000, but the feds would not confirm it, and then we lose a day or two, and that delays the delivery of vaccine.
I guess that's helpful. I personally think I would try 82 or 100,000. Why not? And just see what you get.
Madam,
why
the
let
governor
them limit?
asked Dr. Redfield and the federal government for as many doses as we can get.
Well, maybe you could look into that further and see if you can communicate with somebody maybe in our delegation in DC to find out what that's about and whether we can request more than that number. Because if we could and we could get this stuff in people's arms faster, it would be better. And I know you share that goal. You made that clear. Excuse me, I gotta turn this thing off. Okay. So, and on that subject, our majority leader talked about more tracking, more clear tracking, so we would understand what was going on. I think that we need to be very clear what our goals are and how we're achieving our goals. The goal you stated was to get every Marylander who wants it a vaccine, and that's great, but that's a pie in the sky goal. I think it would be really helpful to have some more clear goals about how many people are in congregate living, what's the goal for the timing, kind of a schedule, and then how are we doing on achieving that result, and all kinds of other categories. I just use that as a simple one of the categories. And then that could reflect in where we are in getting through 1A, 1B, 2, whatever. It would give us much more clear information. And what would happen is that if we all had the information, then people could work harder to make things that aren't working work better. And what's more, it would give people comfort to see what was going on. So I think that, and I know, let me say this, Dr. Chan, it feels like you guys are working at a disadvantage. You don't have a secretary at this point that's confirmed. I know you've lost people in the department. I know you're doing your very best. I'm just trying to see if we can't make this work better for the state of Maryland, because what we really don't want is to find our allocation cut because we're not getting what we need and we're not getting it in people's arms. But I thank you for the efforts that you're doing.
And Madam Chair, if I may briefly respond, with the nursing homes, we decided we did not want to take any chances whatsoever. There were about 60,000 nursing home residents and staff in the state, and we allocated a little bit over that, 61,000 doses to those nursing home residents and staff. Now we've asked that CVS and Walgreens, if they have any extra from the nursing home vaccinations, to use those extra for assisted living and independent living, so that there's no sitting around, nothing sitting in storage. We're just trying to use every dose we can, but with these especially vulnerable folks, we wanted to make sure that if someone wanted it, they could get it. And we understand that the nursing home residents have, the uptake has been pretty high.
Okay, I'm going to end there. Thank you very much, Mr. President, Madam Speaker.
Okay, and the last question that we have from the members was Speaker Pro Tem Cherie Sample Hughes, before we go into the County Health Department.
Okay, thank you, Madam Speaker, and thank you, Dr. Chen. And wanted to just really quickly ask you regarding the education, the 1B, I believe, keep looking at my notes, but I wanted to ask you about the higher education piece. I did didn't see them in the same space as K through 12. So I was curious, and you may have addressed this in one of our other meetings, but I was just curious, being that they are going back into the schools and trying to certainly stay COVID-free, why are they not included in that same category as with our K through 12, our higher education institutions, as well as, and I've received some letters from the librarians. So I know that stays in the education space, and I just wanted to get clarity. Thank you.
Thank you so much for that question. And so, yes, we've been in communication with our Secretary for Higher Education and discussions on this, and we are considering what we may be able to do to accommodate those questions and those needs. So, so it is on, we understand that concern, and we are considering it in discussions with the governor's office and others.
Do you have an estimate on the number of vaccinations? What does that look like? I know you're quantifying the various groups, but what does that look like? And I do appreciate you reconsidering them.
Are you asking specifically for higher ed?
Yes.
That's part of the discussions that we're having with the Secretary, with Secretary Fielder, is trying to make sure that we have an understanding of what those numbers may mean, and then how that might impact our overall plan.
Okay, thank you.
It looks like we did have one last final question. If we could, Senator Rosa Pep, if you could make it sure we have a limited time with our local health department rep.
I appreciate it. I apologize. I switched from a phone when I was driving to here and it dropped off. 3 very quick questions. I'm unclear about this. Can people 65 and over in Maryland today, are they eligible to get the vaccine or not?
Not at this time. We are still focused on the 1A population across most of the state, and we are beginning to vaccinate those who may be 75 and older or 65 and older who are in assisted livings or congregate care settings.
So those not in congregate living who are 75 and older, they're eligible for a vaccine or not?
We have not opened it up yet to them. That will be in phase 1B.
Okay, number 1. Number 2 is, my impression is different counties are doing different things. So you're telling me that nobody over 65, nobody over 75, any place in the state, unless they're in congregate care, are eligible for the vaccine right now. Is that correct?
There are individuals and some counties that have begun the vaccination. What I'm speaking to is in general across the state.
So there are different policies in different counties. One of the things we've heard about is people shopping. I've heard this in the district, older people are getting vaccines. Obviously, other states are getting vaccines. And you're saying in some counties, older people are getting vaccines, but in other counties, they aren't?
So we have heard in certain circumstances where some of those circumstances have happened where individuals and other priority groups have been vaccinated. We continue to work with all of those jurisdictions and facilities to the extent possible align with the state's priority groups. However, there will be some differences depending on the jurisdiction.
Okay, thank you. Last question. We know there's been a lot of chaos for the last year because of the Trump administration not having its act together. That's going to change next week when President Biden and Vice President Harris take office. My question is, to what extent have you had interaction with the Biden transition team on all of these issues?
So I know at the national level, the Association for State and Territorial Health Officers, of which the Maryland Department of Health is a member, has been in conversation with the Biden transition team and provided some high-level feedback for states. In addition, there's been some conversations, and we have provided feedback directly in writing to the Biden transition team as well about overall needs that the state has, not just in terms of vaccines, but also in terms of our overall COVID response from the governor's office and from the Maryland Department of Health.
Thank you. Thank you, Mr. President.
Thank you, Senator. We appreciate you both. Thank you for being here today. I do just want to make a final point that what is abundantly clear is that communication is essential here. And I know that you all have been working tirelessly to make sure that you can make the decisions to get the vaccine out. I would just encourage you to consider other aspects in the administration who could help with the communication plan and assist to provide information to legislators through town halls, centralized points of information. There is nothing more important than vaccinations. And appreciate both your time and look forward to the ongoing conversation. Madam Speaker.
Yes, okay. Our last speaker today is representing the County Health Department. That is Dr. Travis Gales.
Good afternoon, everyone. Can you hear me
Hold
okay?
on.
Okay.
I gotta say a little something else. My
Okay.
computer thing went a little bit wacky. I'd like to introduce Dr. Travis Gales. He is the Health Officer and Chief of Public Health Services for Montgomery County. He is the former Chief Medical Officer of the DC Department of Health, HIV, AIDS, hepatitis, sexually transmitted diseases, and tuberculosis administration. He is also the chair of the Maryland State Immunization Committee and is a faculty associate in the Johns Hopkins Bloomberg School of Public Health. We asked him to join us to get an update on vaccination efforts at the local level. Dr. Gales, and thank you for your patience.
No worries. Good afternoon, everyone. And thank you, Speaker Jones and Senate President Ferguson, to all the other representatives. Also, thank you to Deputy Secretary Dr. Chan and the MDH staff who has worked closely with us at the local health department to be able to provide us with the vaccine to distribute. I had an opportunity to listen to their testimony and their updates, and they have covered a lot of key salient points, and I'll try not to reiterate stuff that's already been discussed. On a local level, our supply that we receive at the health department is contingent upon what the state provides us. So much like Deputy Secretary Chan talked about how the state receives their doses from the federal level, that's how we receive our doses from the local health department perspective. We usually get, I think we've been notified typically on the Saturday, Friday or Saturday before the upcoming week of our next week's allocation. Those doses are usually delivered usually Tuesday afternoon or Wednesday morning, and they are put into circulation typically on Wednesday as far as the following week. Now, what the framework that we have set up in Montgomery County mirrors some other jurisdictions. There are some slight tweaks. Certainly part of our challenges is we have a significant population size. And so just as a point of scale, when we're talking about how many individuals fit into the 1A category, in Montgomery County, that is somewhere between the 50, 60,000 individuals. And just to put that in perspective, the allotments that the health department has received, the first week we received 100 doses. The second week was 4,200 doses. The third week was 8,600 doses, and then we received 6,900 doses this week, including 6,700 directly to the health department and the remainder for second doses. And so we, as of yesterday, before the new allotment of 6,900 doses arrived, we had administered 96% of those doses that we had received. So let me give you the exact number and pull that up for you. That represents 12,505 doses of the original 12,900 that we had received. Now, we have been utilizing large venues, including multiple recreation centers, to provide our sites of distribution. We have added additional sites as we've moved on in each week. Our next proposed model includes 3 large venues that are providing vaccination utilizing the PrepMod scheduling system, as well as we have partnered with our first responders, including our fire and rescue services team, to utilize our public safety training academy as one central site for the county first responders, including our corrections officers, sheriff's department, fire and rescue teams, as well as the police departments of our different municipalities. And so we have included them into our dose allotment, and we are estimating that they will cover approximately 3,000 individuals on a weekly basis. And as they utilize those vaccines, certainly pulling more folks in. Now, in addition to the sites that we have as a county, we have also met with our hospital partners. I know that this was an area that was discussed in terms of the number of doses that hospitals are receiving versus who's actually getting them. And so we have met with all of our hospital partners, and we'll be putting forward, they provided a plan to us that we will be moving forward, utilizing hospital spaces in addition to their clinical staff, their clinical space, as well as some of those doses that they have not been able to use for their actual staff, whether it's through staff is not accepting the doses, as was discussed before as well, to start, chipping away at those remaining numbers and individuals who are included in the 1A category, and certainly moving to the 1B category when we're talking about age-specific criteria. So those are our primary infrastructure points where we are. The rate limiting step is obviously the doses that are received. Right now, I know that there was a question asked in terms of the population sizes versus those doses received. And so I just want to be clear. I know also when you look at the maps, again, another question that was brought up is the percentage of individuals covered within a jurisdiction and how that compares. Now, so certainly I know that Deputy Secretary Chan mentioned the population piece. I do want to emphasize again that of the up until this morning with the new allotment of the 12,900 doses we received, we have administered over 12,500 of those doses. And so while that is a smaller number in terms of percentage of the population, given that we're talking about over 1 million folks, that's 96% of the doses that we've been allotted that we're pushing out. And our perspective is consistent with the state. We're not going to wait for everyone in a particular group to get it. I won't say it's the Southwest Airlines model. I'm more loyal to American Airlines. So as a disclaimer, so I'll just say that we're continuing to move forward and move quickly to increase access. Now, there are some differences within the different state, the local health departments. Obviously, with size, some of the other jurisdictions have completed their different categories, for example, the 1A category, and there are efforts, to move forward to be able to provide vaccine to other areas. The last thing that I would highlight is that we have over 400 group homes and assisted living facilities here in Montgomery County. All of them have been partnered with a pharmacy partner through the state and federal program. And when the state moves forward with the 1B category, all of those residents and staff will be able to utilize that partnership to be able to get vaccine coverage. The last thing I'll mention, I know the previous one was mentioned, but the last thing I'll just mention is we have undertaken tremendous efforts to address a lot of the educational concerns and issues around outreach and education. Some of our different groups have identified key stakeholders throughout our communities and have held a number of focus groups to be able to determine what are issues around vaccine hindrance and anxiety. And we have been trying to utilize, again, key stakeholders when they receive their vaccine to be public about their experience and share that experience, including myself. I am due for my second dose on Tuesday, and we've been very clear with the public, giving updates in our weekly press briefings about how I responded to the vaccine and how other key personnel within the county have responded as well. I will stop there, but happy to answer any questions you all may have, and thank you again for the opportunity to be with you.
It does not appear that we have any questions. I will just ask one particular, as the local rep that I've heard. If someone is a Montgomery County resident, where would you expect them to go to know when they would fall for a vaccine or where they would go?
Yeah, so we, like many of the local jurisdictions across the state, have comprehensive vaccine websites as part of our COVID-19 response. And so, for example, in Montgomery County, our vaccine page has a couple of key points. One, we put out a survey, and then this is consistent with, again, a number of local jurisdictions, put out a survey for, it was initially aimed for healthcare providers to be able to sign up so that the health department had their contact information and also had an understanding of what types of services they provided, because we've prioritized a little bit, within that pyramid, given the shortage of doses that we've received so far. And so we've utilized that platform. We've also created another an information alert system so that any resident within the county can sign up for that, so that they will get weekly messages and updates, so that they'll have a general idea of when it may be their turn to move through the queue.
Okay, it does look like we do have one question. Senator Roosevelt.
Thank you, Mr. President. Thank you very much, and thank you, Dr. Gales, for all you're doing. You're one of the heroes here. Like there's so many across the state and across the country. I appreciate all the websites and all the passive information and all the sign up stuff. But I'm going to channel my friend and colleague, Delegate Justin Penny Melnick here for those folks who don't speak English, they're not on the web, they don't have broadband. I worry about the folks who aren't asking. I mean, I got a lot of constituents who are asking me all the time, where can I get it? And I got a lot of constituents who are like, I don't know. They'll tell me sometime. So tell me a little bit about the outreach to the people who aren't going to the websites and aren't speaking English and aren't all over you.
That's a great question, and you're right. Everyone is asking, and so the state has a communications plan in place. I think they discussed that and shared that. At the local level, we have been utilizing, for example, within Health and Human Services, we have 3 minority health initiatives and programs. The African American Health Program, Asian American Health Initiative, and Latino Health Initiative. And they have all been actively engaged in our pandemic response so far, whether it's testing or contact tracing. And they have been providing a lot of feedback to us in terms of creating communication messages that are respective of language differences, as well as doing that survey work into the community, again, speaking with key stakeholders to get an understanding of, everybody has some general vaccine questions and issues, but are there specific issues within specific communities? Because what we want to make sure that we do is when we put out messaging is that one, it's actually addressing people's concerns. Simply putting out messaging saying the effectiveness is this, and this is the latent period, and this is the period, not being overly scientific, but actually speaking to folks to find out what their issues are and then working to address that. I think that it's going to continue to be critically important to come up with diverse strategies around registration. So right now, all of our registration is online. So healthcare providers can go in their offices, their staff can do that easily, but recognizing that access to technology may be a significant issue, particularly based upon age. So just throwing out some general ideas and things that we're thinking through, it's like, well, maybe we create actually kind of like the grocery store, senior specific times. So saying, at the location X on Monday, Wednesday, Friday, is only going to be for those who are 65 and up or 75 and up, as well as working through, we've met with our aging and disability team to get some consultation who are the experts within the county with the different populations, again, to figure out what makes sense and how do we take the operation that's scaled up, to do large scale vaccine distribution to address some of those special needs within different communities. Again, whether it's language and communications or also access, recognizing that having large community sites is great from a large scale perspective to bring lots of people in, but, it's hard. It's not easy for everybody to drive. Not everybody can drive and not everybody has access.
Absolutely. I appreciate that, Dr. Gales. Senator Hayes and several of us are working on legislation. We'd love your input on it in terms of bringing this out to people where they live, bringing it out to the community centers, bringing it out to the schools, bringing it out to the churches, because saying trust the science for people who don't trust the science doesn't work. Mm-hmm. So trust in God. Let's work there too. Thanks very, very much.
Thanks,
Thank you.
Well, that wraps us up. Dr. Gales, thank you very much for your work on this. Thank you for the information, but also I do want to make sure to note, please stay in touch as things, as this rolls out. If you are having challenges at the local level, or if your colleagues are in other counties, please make sure to bring that to our attention. This is going to be a marathon and not a sprint, unfortunately. And so we appreciate you and thank you for your work and the ongoing conversation.
Thank you for the opportunity. Will do.
Excellent. So that does it for the first day of session and the COVID work group. Appreciate everyone's attention today. There is truly nothing more important than getting these vaccines into arms. It is the key link to a restored economy, a restored education system, you name it. So This will be an ongoing topic throughout the rest of this session and unfortunately probably after that as well. So thank you all. We'll keep you posted on the next work group. Check the website and we will see you virtually likely tomorrow. Madam Speaker, any final remarks? Or see you soon.
Yep. See you soon. Everybody be